Hi everyone, so today we're going to go over a quick overview of PICC assessment, care maintenance, and dressing changes. So today I'm removing my mask for education purposes, reminding you that you'll be wearing the proper PPE when you are doing this procedure. So your PICC should be assessed every shift. The assessment includes looking at the site, looking at your patient, looking at the tubing, looking at the hub, looking at making sure it's not occluded. If it's leaking at the site, you're going to be looking. So when you go in and you do your assessment, you're going to be looking at your patient, see if there's any tenderness when you're palpating. You're going to be palpating all the way around, feeling for edema, swelling, looking at redness. You're going to be looking at your tubing to see if it's occluded. And when the dressing was changed last, and you're going to be looking at the dressing as well, seeing if the sides have been lifted, if it's saturated, if it needs to be changed, okay? Along with your daily assessment, you are going to be flushing it once per shift, and you're going to be documenting it on ACE with, there should be a place on ACE for you to document it, and if you want to make it easier for your peers, put it on Snapshot so they know that it's been changed, okay? During your flushes, you're going to be unclamping and clamping as per needed. You're going to be seeing how well it flushes. You're going to be looking at the patency, if it aspirates well. If the tubing is kinked, try to unkink it from, try to troubleshoot, see if it looks good and see what makes it easier to flush and if the patient is tolerating it well, okay? When flushing on assessment, we are going to be flushing with 10 milliliters normal saline. If you're giving medications, blood transfusions, taking blood, PNs, if you're accessing the site at all, it needs to be flushed with 20 milliliters normal saline. It needs to be aspirated first, and then with the turbulent flush to finish off, okay? You're going to be clamping it and unclamping, like I said, proper sequence of doing that. And to get started, I'm going to show you what it is like to flush, first of all. All right, we're going to start our flush now. We're going to make sure that we are unclamping the PICC, and we are going to disinfect the hub. We're going to wipe or scrub for 30 seconds, and we're going to let it dry for 30 seconds. I'm just going to go ahead and go, saying that it's dry and clean. And attaching our flush, we are going to aspirate until we get flashback, making sure the aspiration is good and it's coming back properly, and then we are going to turbulent flush, making sure that flushing is good, looking at our patient to make sure that they are tolerating it well, and then we are going to clamp it again when we are done flushing. Okay? Okay, so now I'm going to demonstrate how we're going to take the dressing off. I had already washed my hands and put on just clean gloves. So to start, I can see that this dressing has been changed, or last time it was changed was 7 days ago, and it's in pretty good shape. And I'm just going to start taking the tape off. And with gloves, we all know how difficult that can be. So I'm just peeling the tape off, making sure not to disrupt the line placement of the PICC. This one is where it kind of gets more difficult because remember it is a sterile procedure, so I don't want my clean gloves, dirty gloves, touching the actual site itself and anything under the dressing. So I'm going to be carefully peeling off the dressing, starting with the edges. On the site, and we're going to be peeling it off parallel to the and here you can see at the underneath part so you can get a better look. And when you're measuring the external site, making sure that you're measuring from the site, the insertion site, to the little butterfly here at the top of this little sticky for the securement piece of it. And this will just unslide from here And peel this off. If it is super sticky and the patient is having issues with peeling it off, using the proper wipes to help take it off to ease the discomfort. All right, now we're gonna go ahead and I'm gonna open up my sterile kit and get some sterile gloves on, and we're gonna put the new one on. Now that I've done hand hygiene, put my sterile gloves on, have my sterile set open, my dressing site, I've opened up my chlorhexidine swabs, and my PICC dressing is all sterile at the moment. And I've also included my primed new hub that I will be replacing during the dressing changes also on my sterile set as well. So we're going to take our chlorhexidine swabs, and we're going to be taking, carefully lifting up the catheter, and we're going to be doing circular around the site, taking off any like dry blood and going inside to outside, cleaning underneath where the site was, or where that securement device was, and cleaning until it's visibly clean. And we are going to wait until we can physically see that the site is dry. We can't wait. It's usually approximately about a minute. Okay? We're discarding this. And to save time, I'm going to go ahead. I can see that it is visibly dry. I'm taking my new securement device, and I am lifting up this catheter. And I am placing the new securement device, making sure not to move the site placement. I'm placing this down here. If it is still wet, it is very difficult for this to be placed down, and it won't sit as nicely. So I'm just holding, you can see with my hand, I can see the catheter is staying still. Make sure it's in there properly. Putting the butterfly down on this little spot and securing the catheter underneath this. Pulling this tab up and over just to secure it in place. We are taking our new PICC dressing, and we are pulling off the base. This, discarding, and see the open site, we are putting it over top of the site itself. Making sure to leave that unclamp, or the clamp, easy access to us. Going all the way around. Peeling these parts off. We're talking to our patient, making sure our patient is doing okay with the procedure as well. Gloves are very difficult when peeling off sticky things. So now we have these two parts left. You're going to be documenting the date and the time and your initials of when it was last changed, okay? Just so it's easier for everyone so they know when it was changed last. So we're peeling this part off, and the sides are not sticky, so it's a little bit nicer. And you're just going to lift up your clamp and your tube. You use your fingers and just slide it under there so it is, I'm not doing a very good job, but you get the gist of it. Peeling this off as well. Now I can just be clean, and I'm going to write my pen, the date. And I'm just going to put this right across where everyone can see, making sure it's not over the site. All right, that's done, and then we go into change. Ready? And because I do not have a proper PICC line in this mannequin arm, we would, during the dressing change, we would change the hub, making sure that the hub is primed and ready to go. And while we are 100% sterile, we'd be taking off the hub and replacing it. Just so. All right, so just to recap, assessing the PICC line itself, the site, the line, the dressing, self-care, making sure that you're flushing it. You are checking and assessing your PICC once a day. You are flushing it once a day. You are changing the dressing every 7 days or as per needed. Making sure that you're changing the hubs, and the dressing change is sterile, making sure that it is a sterile procedure, and changing the hubs is sterile, and making sure that your patient and the PICC line is okay. You are doing the external length assessment every day as well. And you're making sure that you're documenting an ACE and doing the snapshot for your peers, so then everyone knows that it has been done. Okay? Awesome. Thank you for that.